Welcome to In Search of Value from Mingle Health. In this interview series, we'll explore the transition to value-based care from the perspective of individuals inside the healthcare system. Here are our hosts, Allison Casaccio and Charles Howes.
I'm excited for today's conversation with Dr. Dan Mingle. He's the founder here at Mingle Health. So often we hear from him on the latest in the regulatory news from the final rule, the ins and outs of MIPS and different quality measures. So I'm excited for today's conversation to hear about Dan Mingle, the person who evolved to be the founder of Mingle Health and where he came from and how he got involved in medicine.
Yeah, I agree. He's got a really long experience in healthcare, in quality improvement, in practice improvement, and this has all led to value-based care, which of course is what a lot of people are talking about right now. So um, it feels like what listeners can take away from it is that long experience and see how things have changed over the years, and that always leads us to our next step, right?
Yeah,
So,
absolutely. I think when we talk about the
yeah,
transition to value-based care, there's the patient experience, the clinician experience, how clinicians are part of a larger system. And Dan really has experienced each piece of this throughout his career and his training. And so I think it's a great conversation and lots of little nuggets to take away.
can't
All
wait.
right, let's jump in.
Hi, Dan. It's really great to have you here today. Just as a first section of questions, I really want to talk about who you are and what you do, just to sort of give our listeners an idea. Tell us, how did you get involved in healthcare in the first place?
Oh, great question. That takes me really far back. I was raised in rural Pennsylvania in a retail environment. So I worked my dad's store from the time I was old enough to empty waste baskets, and uh, I loved living and serving a small town. And thought that healthcare was an even higher calling, and so I fled the business and to head for the circus of healthcare. Uh, Now, subsequently, I've learned that selling hardware and paint and clothing has more grace in it than I had initially thought, and perhaps there's a little less of it in healthcare than I initially thought. But still, it's been a fun interlude and a fun pursuit.
So, if you were going to describe what it is you do today, tell us about that. We touched on the beginning of your journey. How about where you are
Yeah.
today?
Um, I keep track of changes in regulations, changes in legislation, health policy, market trends, um, uh, and try to interpret that uh, in, uh, uh, in a set of what do doctors need to thrive in this environment? What do patients need in order to get the care they need in this environment? How do we pull that together? And how can we as a company um, uh, create a set of products and services that help bring it all together?
What do you think has been your most meaningful learning or even just the best training ground for you?
Well, it's got to be years in front of patients that I just love taking care of patients, and I love that role um, in uh, in the community. I also, in a couple of pivot points in my life, I pursued some temporary work. So I would go into communities that were shorthanded and work for a period of time, and that gave me a wide exposure to different methods of practice, different community needs, and I've always had a passion for figuring out how things work, and that's uh, I think that combination, being right there face to face with patients and having the opportunity to see a number of different communities and styles in action.
Lots of different
Yeah.
perspectives.
Healthcare is full of things to understand how it's working. It's different systems, the different states, the different payers. Curious in terms of
Yeah.
training ground in your journey. If you could talk a little bit about how you went from patient care to today at Mingle. What brought you to move outside the patient context?
Uh, another good one, and maybe tapping into an even bigger conversation than we want. But from the time I opened my practice. Oh, well, let's go back to the initial thought. As I was in training and heading for practice, I always imagined taking such good care of my patients I could spend most of my time in the garden. Now,
That's lovely.
that didn't work out terribly well. Uh, Practice is incredibly demanding. And again, I was sorely disappointed in how what passes for service in healthcare wouldn't have been something you'd see in my dad's store. So I've been from the very earliest stage trying to figure out how to move my practice into uh, well, the words are there now that weren't there then, like patient centeredness, accountability, value. I was attempting to move in those directions and finding some uh, incredible barriers to progress, mostly in the status quo. And the regulations, the insurance relationships, the patient expectations all uh, uh, seem to be engineered to keep us in the dysfunctional state we're in, and the doctors I brought into my group practice tended to have a particular idea of how they wanted to practice medicine, and um, those ideas I had of improving value tended to not be compatible with those issues. So finally, I stepped away from my practice. Which by that time, a couple years into having sold it to the hospital, I found that wasn't working for me at all. Um, and uh, I thought about some of the ideas I was seeing in the literature, how to transform my practice, and decided instead of just jumping right back into it, I wanted to study that a little bit, get a little more experience with those advanced techniques, and then open a practice. So that was a slippery slope that led to where I am now. So um, uh, a fallen practitioner, I guess you might say, or a recovering family physician. And that led me again, some of my temporary placements were during that period of time, and then I landed in residency training, first as a part-time preceptor, and then full-time faculty. Intended to be temporary, study these advanced practice techniques, and part of my earlier experience had been an aptitude for the electronics. Which I was an early adopter of electronic practice management systems and of patient education systems. And so I brought that to the residency, helped them. At the time, we were implementing uh, personal data assistance, if you can remember that far back. And when Google was fresh, we were doing, it was brand new. We were doing internet searches for some of the resources that we wanted. Um, and I also was given leave to pursue the Institute for Healthcare Improvement's idealized design of clinical office practices project. Always a mouthful, but it was exciting. It was interesting. Dartmouth's faculty was very prominent. Uh, very strongly represented in that process. And that led me to matriculating during my time as residency faculty in what was then the Center for Evaluative Clinical Sciences at Dartmouth, and now called the Dartmouth Institute. And again, a great training for practice improvement and measurement of healthcare value. about the same time, I was still faculty. I was still part-time working at the residency, part-time going to school, and part-time or full-time uh, running the. I took charge of the electronics program at the community hospital where I was working. So I was director of clinical informatics, chose and implemented an EMR and supported it. Those nestled nicely together, and most of my class projects were around that utilization of EHR uh, in that community health system. We're one of the few organizations that implemented EHR without a loss of productivity, uh, which
Oh, that's
um,
fascinating.
which ended up being an idea that didn't sell well because no one believed it.
Yeah. That's super fascinating to me. What do you think if you were gonna say one big driver at the time for that organization moving to an electronic space? What was on the minds of the physicians and the clinicians and
Oh my. Um, I think we had a hospital administration that was bought into it, felt the truth behind the notion that electronics would drive value in practice. Um,
Mm.
I'd say the physician's attitude toward it. There were enough of those bought in the leadership positions that it flew and it sold. But I'd say the majority of physicians were just skeptical and a little frightened.
Sure.
Quite cynical. I remember what was pleasing to me is we rolled this thing out, and people who were just dragging their feet and obstructing things. Once it went in, remember a common type of comment was, "This is stunning."
Mm.
That when I'm
Interesting.
a specialist telling me that when I'm getting a new patient now, I get access to their electronic chart, and I now know everything about them at the moment I see them, and I
Wow.
had never happened before. Uh, and that's really what drove things. Those who knew loved it, and those who didn't remained scared. But we were able to
We're a little scared. Yeah.
push it through with a record of success.
I want to move a little bit into some of our questions about really being in search of value and exploring value-based care because a lot of what you're talking about I think touches those elements especially early on. So, what does value-based care mean to you?
Well, it's a great product at a great price. That's really the goal of any business person, no matter what the business. And it I think we there's room to be a little ashamed of what we provide in healthcare, being the most expensive in the world and lagging below average in just about any of many different methods of measuring value. That's the World Health Organization is a common um, uh, arbiter of these things, and uh, with maybe a couple dozen different measures of what constitutes value, and we don't tend to be outstanding in any of them.
So, what do you find most challenging about the healthcare system when we're talking about value and
Well, I
valuation?
think it's that notion that interesting. A quote attributed to J. Uh, um, Edward Demings. Every system is perfectly designed to get the results that it gets. Um, it really
Mhm.
is uh, all of the forces that keep us maintaining the status quo. Um, is I think the most frustrating thing about it. It is the model. The healthcare model that's in everybody's mind, what we pursue, how we're trained, the peer pressure, the even the payment uh, uh, um, payment styles, all of that conspires to keep things the same. Our patients are complicit. They also have that certain set of expectations. There's certainly a lot of things that frustrate patients, but I think overall the it is really difficult in practice to do something innovative, new, and works better. And it's also a system that really demands a level of finance. A level of cash flow. That old moniker that no money, no mission really becomes enslaving. That it's too easy for it to become a search for the money rather than the mission.
I don't want to say that it's easy to point out problems. I think there are a lot of barriers in healthcare and we all see them. I think there's also some really exciting things happen. Can you tell us about what you're most
Oh
excited
yeah, no,
about
this is
in healthcare
a
right now?
great time to be in healthcare. I think it's
Mhm.
things are changing. That's I think the most exciting thing about now, and um, incentives seem to be slowly aligning. There are pressures that are really putting pressure on the system in positive direction. Uh, I think you know I love the simplicity, uh, the clarity of the message from the Institute of Healthcare Improvement that the triple aims: improve the health of our communities, improve the health of our patients, and improve access to care.
Mm.
That is really the crux of the matter. It's what I've been pursuing for all these years in practice without really knowing the verbiage, and love bringing it together. And even more brief is the Consumers for Affordable Healthcare, saying um, high quality affordable healthcare for all. Really, in a very small number of words, expresses that idea. Um, Getting back to that your question, Allison, of what is value? That really
Yeah.
is it.
The two that I've been really focused on lately are physician satisfaction, clinician satisfaction. How healthy physician
Hmm.
burnout is a huge problem, right? And then at the same time, equity of care delivery and how do we make sure that we're reducing disparities and all those sorts of things. And one of the things that I've started doing that I feel like in the beginning I was saying, I have something to teach you, so here, take this. Right. And then as my career moved on a little bit, I started recognizing, oh, I need to listen first and then decide if I have something to give you. And now I'm to a space where I'm just saying, tell me a story and let's just collect them all and see what happens, right? And so the question that this leads me to for you is, can you tell me a story of the most meaningful or inspiring interaction that you've had with the healthcare system?
Oh my, most meaningful and inspiring out of
Out of a
yes, out of a
lifetime of
lifetime
stories,
of
right?
not a lifetime experience yet. I'm still here, so haven't
Sure,
finished that.
sure.
Uh, a situation where one of my one of my favorite patients came in to see me uh, short of breath. He pre-existing COPD, and he proceeded to turn blue and collapse in front of me. Um,
Oh,
and um, a little mouth to mouth resuscitation while the ambulance was coming, and he lived to leave the hospital. Um,
wow.
uh, but paling that pales in comparison to the hundreds of or thousands of of deliveries I attended, and just that miracle
Oh.
of birth.
It's interesting when we talk to and when we interview clinicians in direct practice, because it sets the bar for what's the worst day at work I've ever had. What's the best day at work I've ever had, right? It's a different scale, and I think part of that is also part of why addressing burnout issues and addressing values.
Mhm.
Yeah, and these are real people. They're real lives.
Yeah. Uh, Medicine is actually life and death. And,
Mhm.
giving people meaning to, as they experience steps in either direction to, the correct diagnosis, being listened to, having a good experience with the healthcare system, reconciling that with what you've talked about, Dan, which is, the clinician really seeking to see their work in action. And yet, how do you align the economic model to make that all possible in a way that is delivering value, as you kind of said, a good product at the right price? I'm curious if there's any particular incentives or programs or dynamics that you've seen in your vast experience that are a bright light in driving in that direction, towards the value that you've been talking about.
Well, I think I've got to say that the new primary care first program really seems to be driving in the right direction. On top of that, to a lesser extent, all the structure of um, the ACOs and the MSSP, where you get better reimbursement, better if you are saving cost and improving quality. Um, the primary care first program is particularly exciting because it's not so based on uh, codified deliverables as it is care. There's a substantial amount of upfront um, money to manage patients, and I like that approach. It gives the physician complete control or near complete control over what's delivered to provide help, and not having to comply uh, with the coding rules to couch it as individual services. Um, the whole has to be more valuable than the means, and the usual coding, the usual practice, um, is so slave to the individual services in ways that some of our more difficult care uh, um, challenges just don't fit into those models.
So I have some questions that are just sort of just some additional exploration, some closing questions, some things that I think our listeners might be interested in your opinions on. What trends are you currently watching?
Well, I think I've touched on some of these earlier. Um, uh, again, that evolution of payment models is one. Moving away from the pure fee for service model to the alternative payment models, and I like um, Medicare's stated goal of driving us toward full capitation. Um, now,
Mm.
again, there's a lot of ways to do it. There's bad ways and there's good ways. So I like the pace. It's not just happening overnight. They're moving to capitation. Um, I think keeping stock along the way is a good one. I also like the trends in coding. The fact that there's been a massive simplification of the CPT codes and dropping all those or a lot of that number of items that you've reviewed, number of physical findings, and just simplifying it to how much time you spent with a patient or what's the medical complexity of the visit. I like that. That's really getting to something that's a little bit more manageable. And I certainly like that the managed care kind of approach where you get a bucket of dollars to use to help with your patient care and a little more free to determine exactly what is the best way to use those dollars. I like the trends in remote care. Um, interesting. Particularly when you're looking at the primary care, but also aspects in many specialty practices, we would be far better off conceptualizing those things as conceptualizing my primary care practice, particularly as a healthcare help desk. And I think of the help desks that I experience, that I like, that work well, that please me, and one of those factors is an abundance of different ways to connect to help. Uh, and in healthcare, the fee for service system and the regulations have kept us in a person to person, face to face a technique. But there's a lot of other ways we can do it. So I really like how telehealth is gaining some more traction with every set of rules that I see come out for the last few years. That ice has been broken. I don't think we'll ever
Yeah,
get the toothpaste back into that
in
tube.
a big
Yeah.
way. Yeah. And from the patient perspective, there's that convenience factor. I want the things I want when I want them, where I want
Hmm.
them,
Yeah.
right? And isn't that a piece of value too in its own way? But you're right, it involves us thinking outside of the way we traditionally have as a result of the rules that are in
Hmm.
place. And I think, that leads us to things like more use of digital health, more use of mobile
Hmm.
clinics, more ability to go where the patients already are. So, do you have any there's a lot of people talking about these subjects right now, right? Do you have any reading or viewing recommendations?
Um, I my favorite healthcare journal would be Health Affairs. I think
Hmm,
they've tended right along um, to capture um, those things that are important to value-based care. Um, so I'd say uh, that is probably chief amongst my recommendations. Other um, formative items. I really liked Collins' "Good to Great." um, it, talking
hmm.
about how, and it doesn't talk at all about healthcare, but it
Right.
talks about companies in general, how they become good and stay good and get better. And a lot in there resonates highly with me. I think one of the things I fault about healthcare is we fail to learn lessons from other industries. That if we
Mhm.
stand on any main street in any town USA and look up and down the street, do you see, or now it's online, you see companies who are handling similar um, problems as healthcare, um, and doing it in far more efficient, effective ways. And we're inclined to say, "Oh, my patients are not widgets or whatever, or the classic
Right.
is my patients are sicker than that, and to believe they
Yeah.
don't apply. But there's so many lessons that do. I talked about healthcare as a help desk, um, those different ways of connecting with people that are. There's abundant examples of that in the community around us, and it would be great if to,
Yeah.
to learn those lessons.
Yeah. I hear a little bit of an echo there too of, we have healthcare, come and get it. Let me give this thing to you.
Hmm.
Right? And maybe it is a transformative effect where it is more about what we were doing in our lives
Hmm.
anyway and how to deliver that as a part of health and as a part of living. Hmm. So this is my favorite question in closing, by the way. Who would you like to see us have a similar conversation with? Given your experience in healthcare, given your experience with this, who's another person that would be great for us to have these conversations with?
One of the most progressive physicians uh, I've met. Um, the practice I considered joining before I went down the uh, open a business rabbit hole. Charlie Berger, an internist who was in practice in the Bangor area, really had a very innovative practice where he staffed up and he worked on providing the care, moving care earlier into the process, and empowering the person on the phone to provide a certain level of help. So it didn't all he was not necessarily uh, he was relieved from being the bottleneck in his practice, and
Yeah.
was provided great patient care and better volume of care, and really achieved early those goals of value-based care. And another leader um, in the new practice would be Brent James, formerly of Intermountain Health, uh, who did some great things working with protocols and improving them and improving the approach to
Mm.
protocol, um, debunking the idea that your goal was to stay on protocol. Well, no, he taught that the protocol is just a guide, and what you should do when you find someone deviating from protocol is not to correct that person, but to understand why they had it, and then correct the protocol. So very powerful. There, did some great work.
I like the connection between value and
Mhm.
improvement that has right? It's been through the entire interview, quite honestly. I really appreciate you coming on today, Dan. This has been really fantastic.
Well,
Thank
thanks
you.
for inviting me.
If folks want to connect with you after they listen, where's the best place for them to connect with you?
Oh, I'd say LinkedIn is a good place to do that. I'd really like to start seeing a more of a discussion developing there, sharing techniques. So, what have you found in your practice or your work, whatever it is that helps get us closer to value? What are the challenges you're facing? Where do you find me full of feces? Um, uh, so any and all productive input would be welcome.
Thank you for joining us for this episode of In Search of Value. Mingle Health is your partner in the transition to value-based care. We help healthcare organizations save time, improve quality scores, enhance patient outcomes, and increase reimbursements from value-based programs. If you'd like to speak with one of our value-based care experts, you can contact us at minglehealth.com.